The quantum leap in medical technology is providing healthcare providers the ability to deliver cutting-edge quality care never seen before, especially in the community oncology setting.
Community oncology is something that is really the core of oncology care in the United States. Most people are aware of academic centers and hospital-based oncology care, but the bulk of oncology care in the United States is given by, I like to call it, your neighborhood cancer treatment center. And this is oncologists who have set up practices in communities where they live and their children grow up, and they treat patients right there in the community with the best protocols and the best treatment plans that are currently available as devised by the academic research centers. So we can take their plans and their treatments and give them right in the communities that people live, making it easy for them and most accessible for them in the United States.
Community oncology is a field where we are providing very complex care to patients in a very intimate, neighborly environment. Essential to that experience is to ensure that we improve communication and also improve sharing information. Those two ideas are what drive a lot of the technology solutions that we're talking about here today. Unfortunately, the day and age where my father, for example, was a doctor who practiced for 40 years and was able to go to the patients' homes and give their cell phones to everybody, that level of intimacy is very hard to duplicate today. And so what we're able to do now is use technology to help us provide the bridge that enables physicians and patients to stay connected in a more intimate fashion.
Enhanced communication and technology advance the quality of patient care, especially for patients with complex diseases such as cancer. Physicians and their staff can use technology to improve practice operations and clinical efficiency, and to better communicate with and care for their patients. Patients can use technology to play a more active role in their health care and feel more connected to their care team.
So the first technology I would recommend is a Zynomed. It's an EHR, and that stands for an electronic health record. And what essentially it is it takes patient information, it stores it, and makes it accessible to physicians.
iKnowMed, which is our preferred electronic medical record, really does a wonderful job of displaying data, organizing it, so that when I see the patient, I have a clear picture in my mind of what's happened, where are we going from here, and what do we need to focus on that day.
Well, there's a lot of functionality that's in the next generation version of iKnowMed. The speed, the ability to quickly access a patient's chart, navigation.
There's a drug called adriamycin that we use quite commonly in breast cancer. This is a drug that, when given in too high a level, can actually cause significant toxicity in the form of heart failure. It's important to always keep track of how much of the drug you're giving. The nice thing about iKnowMed is that it actually blocks you from even giving the drug until you've populated with into the program how much drug has been given. But not only that, it doesn't just retrieve the information that's inside the system, it also even asks you, has this patient received adriamycin at the hospital or another institution, and does that information, does that data need to be integrated into the overall calculation of how much drug a patient has had. Those type of clinical pathways that are feeding the back end of the system is really what I think separates this system from other EMRs, and it allows me as a physician to be comfortable knowing that I'm equipped with the appropriate information, and that there's also a safety net in place to make sure that I do things as appropriately as I can.
Today's technology can also identify patients for appropriate clinical trials, so they have access to the most appropriate, cutting-edge treatments.
iKnowMed, as part of its feature, requires that the doctor enter all the data regarding the specifics of the patient's tumor, the tumor size, the status of lymph nodes, are there metastases present, what stage is the patient. So all of that information is incorporated into iKnowMed, and then iKnowMed can actually use that to say, okay, this patient would be a candidate for these studies, and allow us to look at possible matching up a patient with an appropriate study based on the stage and cell type of their cancer. So it really helps us think about that every day. But this allows you to incorporate a treatment plan right from iKnowMed, which reminds us, saying, hey, this patient would be a good candidate for these studies, and think about that and maybe discuss that with the patient.
Helping physicians who handle specialized pharmaceutical products, especially those for complex diseases such as cancer, is a priority for providers of technology. By creating customized and flexible technologies specifically for the specialist physicians, their staff, and the patients they care for, emerging technologies are helping to advance the delivery of care.
iCare Plus is a web-based application that allows patients to look up information about themselves. And when you have cancer, it's a very serious disease and you want information. So this gives you a one-stop shop to go in and look up information about your care, your treatment, maybe some labs that were given to you, your insurance, and patient education about your disease, so you can find out all you need, and that is critical.
Our patients have been very enthusiastic about accessing the patient portal, which is the easiest way for them to track their data along with us, and it helps the trust relationship between us.
So CMD is a tool that we developed on our own, which is being used currently as a beta in our practice, and basically it's a mobile application that allows for HIPAA-compliant communication between physicians and patients, and also physicians and other physicians. And what's valuable about that is that it allows us to have a more direct, intimate connection with patients in a mobile application, because today most patients are accessing the internet through their mobile smartphones anyway. And it allows us to not only communicate with them in a HIPAA-compliant fashion, but also share information with them regarding their chemotherapy, videos that have to do with their disease, and ultimately improves not only the communication between physicians and patients, but also the sharing of information, whether it be from the physician to the patient or from the patient to the physician.
I think that I like the idea that I can log in and look at my lab results, look at my radiology results, look at all that information and have it at my fingertips. I like that a lot.
To learn more about these exciting technologies, visit Maryland Oncology Hematology online at www.mdonc.com or the U.S. Oncology Network at www.usoncology.com.